Interim Healthcare has been providing home care locally for over 46 years, and they say they touch thousands of patients daily. We are joined today by Tim Rogers, President and CEO of the South Carolina Home Care and Hospice Association, and Kirsten Collivan, Vice President of Growth and Strategy. Guys, thank you for joining us this morning.
Glad to be here.
Yes.
Okay, for those watching and may not be familiar, what exactly is home health care and who does it serve?
Sure. So, home health care, when you think about it, that's when we come into your home, or your nurses and therapists come to your home to help you recover safely. If you've had a surgery, injury, illness, we're able to come in and help you rehabilitate it, get steady on your feet again. If you've had a joint surgery, for example, we can get in and help you steady, do strengthening exercises, educate you around heart failure, all of it in the comfort of your own home.
And you guys do a great job at Interim of talking about the continuum of care, where it talks about, a lot of people think about end-of-life care, but it's not always that.
That's right.
And it's such a broad sequence that you go through.
That's
to make
exactly
sure that
right.
A lot of different things that people can use it for. And we know there's some changes that's coming up, some cuts, 9% cut. What does that mean, and how does it impact those that may be doing like home health care?
Well, let me start off by saying this. Interim is the board chairman of our South Carolina Home Care and Hospice Association. We were founded in 1979, and we have agencies that represent all counties in South Carolina, urban and rural. CMS has proposed cuts of $1.1 billion
Ooh, with a B.
to the Medicare home health benefit, which will in essence be the largest cut in the history of the program, which was founded in 1965. And we're very, very concerned here in the Palmetto State. We have a large number of agencies, sure, that are urban, that serve Greenville, Charleston, Columbia, but a lot of agencies that touch the rural parts of our state. And we already know we have a shortage of nurses and doctors and physical therapists and speech therapists. And if you make these cuts to these agencies, you're going to make them retract their services, already problematic to the rural agencies. And we are so afraid that citizens in the rural counties will be vastly impacted, and they won't have access to home health care, and they'll be treated in more expensive settings, like hospitals or skilled nursing
Those
facilities.
rural settings, a lot of them already have trouble with access to care.
Exactly.
And so the fact that it's going to be more expensive.
Exactly.
Or they just skip the care altogether because
Worse.
it's too hard to, and that's not good at all. Is there anything we can do to change this or to help or?
So, the challenge to us as South Carolinians is that access piece. And when we think about the outcomes to care, and it's important that folks know that those that don't get home health are 35% more likely to return to the hospital. So to your point, Megan, it's a poor outcome for them. And what we want to do is encourage those in South Carolina to be aware and have awareness of our services and recognize that it's important that we retain access to home health care in our state.
Yeah, so we want to wrap it up with like a takeaway. What should our viewers take away from this if they're wanting to get in touch with Interim Healthcare and kind of see what the solutions and options are available to their family? What is the best way for them to do that?
Sure. So it's important for them to know that home health is a lifeline, and that we are there to support them if they have questions, if they have any other questions about this and how they can help support continuing that access to care. We're happy to help them with the Interim Healthcare as well as the State Association.
Absolutely, absolutely. 70,000 citizens here in South Carolina received home health care last year, and we want to see that grow because it's cost effective. More people would rather receive care in the comfort and the security of their own home. Sure, we need our facility care, but I think we would rather be in our own family.
You're more comfortable.
More comfortable with the nurses and therapists from Interim and other agencies serving them. So we're just trying to make families and Medicare beneficiaries aware what could be coming, and to make sure that we're in this together. We're in this to try to help stop this.
Well, thank you for letting us know, because we obviously knew the amazing services that that Interim and you guys do. So I didn't realize about all the cuts and stuff. So this is something for us to think about, and now you know. So the information's right there on your screen. Thank you so much.
Thank you.
Thank you
for your
guys.
time.
For telling us about this.
Thank you.